Good morning, everyone. Welcome to the House Healthcare Committee. It is 9:05 on Friday morning. Hopefully everyone's staying warm. So we are meeting this morning because there is an amendment to the Budget Adjustment Act where the recommendation originally came from, let me back up. It was a governor's recommend in the BAA, and our committee supported in the majority that governor's recommend, which was to add $9.3 million about to the BAA for potentially 9 youth inpatient psychiatric beds in Southern Vermont Medical Center. House Appropriations changed the language slightly to reflect that we wanted to have the feasibility study, once it's completed, returned to us so we could see obviously what the feasibility study said before the money was appropriated. That language made it into the BAA, which was voted on yesterday as a whole, and then third readings today. And that brings us to this point where Ann Donahue is here. If you want to come up, Representative Ann Donahue, I should say, is here and will walk us through the language she is suggesting, and then we will hear from Nicole with Department of Mental Health. So Ann.
Well, thank you, Representative Ann Donahue. And just stepping back on a mini overview, I think folks who've been here before are aware of my, or on the floor day before yesterday, aware of my kind of language focus sometimes to make sure we're actually reflecting intent. And the proposals I was making, the language tweaks, if you will, were intended to make it clear what was already in mind. In other words, based on the actual contract with Southwestern Medical Center for the feasibility study, which isn't just about citing, but also about an assessment of needs, what's an evaluation of what the needs are from a statewide basis, and also that are very specific to beds that are able to address co-occurring medical or complex medical needs. So that was what I was looking to do, and I can walk through with you. But just so you know, I was in a meeting with DMH on something totally separate, but this came up and I shared my thoughts. They had some concerns about some of the wording. When I explained the context, it sounded like, maybe that worked, but I didn't have the language was made, and neither did them, obviously, if I didn't. So I forwarded it to them right away afterwards. And just literally 2 minutes ago, I just told the probes, well, I didn't hear anything back, but I asked them, please let me know ASAP. They have some concerns with this language, just so you know up front. And hopefully we can get at a place where, we're getting the clarification in, but not creating further delay, which is their concern as stated in the email. I don't want to cause that. It's not an intent to disrupt. It's an intent to clarify. So I'll go over with you what I'm proposing, but keeping in mind that I do want to accommodate DMH, and you'll be hearing from them. So hopefully we can work that out. But specifically, I have a version that kind of integrates it as a side-by-side in a way that Ledge Council can't do it, because you have to amend, only the words that are being changed.
So Ann,
I can walk through you on it
slowly, so that we all understand where we are. Yeah, that'd be great.
So there are, the amendment as it's presented has 2 parts, because the first part is the first part of your original language, and it adds a phrase rather than making any significant changes. The current language says that the funds that are being appropriated shall be reserved until a feasibility study is completed to cite a psychiatric youth inpatient facility as specified in the bid. In other words, in the contract, the bid proposal. And, my concern is it makes it sound as though just how it would be cited is what's in the feasibility study. And the feasibility study does start out specifically with an evaluation of the need, what the statewide need is as part of, how many beds maybe this should be and so forth. And I thought it was important to not suggest that it's sort of predetermined in some way, but that you will be getting back. The feasibility study needs to be completed, and that is part of the feasibility study. So I used the language that was in the contract, which says evaluate the need, that's the words, and then adolescent inpatient mental health services is also from the contract. So that was intended to reflect, that's part of the feasibility study, not just to cite, but to evaluate need. The second.
So I'm sorry, Ann, can we say that? So can you read the sentence?
I'm sorry, yes.
Have it read.
So the full sentence would be, these funds shall be reserved until a feasibility study is completed to evaluate the need for additional adolescent inpatient mental health services and cite a psychiatric youth inpatient facility as specified in a bid or proposal submitted in response to the RFP issued by DMH on February 8, 2022. So it continues to refer back to as specified in the, well, that may be a technical, in the bidder proposal, it's actually in the bidder contract, the contract that resulted from the RFP.
So before we move on, is everyone clear on what she's asking us to change the language to? Okay, we're recommending the language change to. Okay, go ahead, Ann.
So the second part makes it look like it's adding a whole new paragraph. It's not, but because there were enough, wording additions, Ledge Council wrote it as a new paragraph. So the part A under the existing language, the first sentence is not changed, so it's not rewritten there. But that's the part that says DMH should submit a report outlining the findings of the feasibility study. So the second sentence, as it is now, says if the proposal is not feasible, DMH shall report on alternative plans. And my concern with that is, well, if it shows it's not feasible, but the reason it's not feasible is that, there aren't enough beds needed, DMH is still being required to report on alternative plans to increase the number of psychiatric inpatient beds in the state. And it's really not about increasing psychiatric beds, it's about increasing being able to meet the medical needs. So my attempt to address that was to create the rephrasing that adds, and then I'll go back and read the whole thing, but that adds that the study does show a need for additional beds, but that this proposal is not feasible or appropriate. In other words, as judged by DMH from the feasibility study, then they shall report on an alternative plan. And it adds that phrase that can accommodate co-occurring diseases and potentially complex medical needs, because that is specifically, it's also the language in the contract. That's specifically what this is looking to address. It's not trying to address overall inpatient youth beds. It's trying to address the fact that, many at the retreat are closed, and the retreat does not address co-occurring medical needs. So that's what the focus is of the need. So the way that sentence would read in full with those added phrases would be, in the event that the study does show a need for additional beds, and that's referring to the feasibility study itself, but that this proposal is not feasible or appropriate, DMH shall report on alternative plans to move forward with increasing the number of psychiatric inpatient youth beds in the state that can accommodate co-occurring disease and potentially complex medical needs. And then it adds the second sentence there, the alternative plan may include the issuance of a new request. That's part of the original language, but it had to be split into a separate sentence. Otherwise, the whole sentence gets much too long.
Everyone clear on that? Okay. Any questions for Ann?
I was a under the impression from the testimony we've gotten that it's already been established that we need these
We're
beds.
going to hear from DMH.
Okay.
Any questions specific to Anne's request? Great, thank you.
Thanks. And I'll stand by it. Did you
Absolutely.
want me to stay sitting here because?
Well, can you just go a little bit that way so I actually can see Nicole? Thank you. Hi, Nicole, welcome. Please introduce yourself and let us know what you think.
Good morning, everyone. My name, for the record, is Nicole DeStasio. I am the Director of Policy for the Department of Mental Health. And I am here on behalf of the department to kind of talk through, I both want to address Anne's concerns, which I think are kind of like, why are we doing this and how are we doing this? And then I also want to talk a little bit about the impacts to the project if we were to move forward with accepting the proposed amended language. So those are roughly the two topics I want to chat through with you all. So the first part is why are we doing this? And I think it was Representative Goldman perhaps who had just said we believed we had already made this decision. It's been informed by a significant amount of stakeholder engagement. It's been informed by testimony and conversations we've had with the committees of jurisdiction and other folks last year. And I think where we're at with this right now is that there is a significant need for the state of Vermont to diversify youth inpatient capacity from the Brattleboro retreat. They are not able to take these medically complex or individuals with co-occurring disorders. And so this is some of what is causing emergency department wait times to be impacted for our youth that we really wanted to make sure that we addressed. We also have heard from stakeholders that they want some choice. They don't want the Brattleboro retreat to be their only option. They would like to have some options. And so this is also to address that. And part of that has to do with, we talked in testimony earlier this week and last week, and the Brattleboro retreat joined us, that, last year they had some significant challenges. And while they've made a great turnaround, we still think that there's a little bit of community and relationship building that the Brattleboro retreat needs to do to regain some of the trust of Vermonters. And so this is what has informed our decision as a department and as a state to move forward with providing a second location to address youth inpatient needs, and also with the specific eye towards the medically complex and individuals with co-occurring. So the second thing I wanted to talk through is the impact of this language. And I can appreciate that there are nuances in the contract that make it seem like there is a broader scope than there actually is. This particular contract is really about the feasibility to determine the number of beds and the approach at Southwestern Vermont Medical Center. We have asked that their report and the feasibility study to be informed by kind of statewide data and information, but this is not a statewide needs assessment or a statewide evaluation to determine whether or not the state needs beds or the number of beds that is needed statewide. So the scope of work here is really specific to Southwestern Vermont Medical Center. I don't even believe that we could make an amendment to our contract to include, to change even their current contract. Because the scope of work would be so different, we would likely need to re-RFP, or we need to RFP that scope of work to do a statewide needs assessment. So adding that in would really slow down this process by quite a bit. And I think and then the final point was if we were to do a statewide needs assessment on beds, I think that, Southwestern Vermont Medical Center may even have a conflict of interest there. So I'm not sure that they would even be the right choice to do a statewide needs assessment. We really need to think through that a little bit more. And so I'm concerned about that part of the language as well with what is currently suggested as an amendment.
Thanks, Nicole. Can you tell me in the first section you talked about the broad categories of stakeholders you met with?
Yeah, we did. So I'd have to get back to you to really be specific and to be able to cite what the times and locations. But we have had some significant conversations with families and individuals themselves.
Great, thank you. So Leslie, I'm going to go back to you if you wanted to expand on your question at all, and then.
Well, I think my understanding from Nicole is that the need has been established and that's not the question on the table. The question on the table is, working with Southwestern and sort of moving through that process. Is that my understanding?
Nicole, that's a question.
Correct.
Yeah.
Any other questions for Nicole, or if Anne, you want to add anything?
Yeah, I would. And it's partly, I think, to Nicole, because what Nicole is describing is not at all what my intent was, which is why I drew the language from the existing contract, not from suggesting that the study do something new or different. And when you look at the language, it talks about until
You reference the language that you're looking at in the contract, what?
Yes, the language, and that's what I was going to suggest, there may be one word that needs to change but the language in the contract, do people have that?
Yes.
Okay, so under the statement of work, description of work, it's the fourth page. It's where it starts the actual description of what they're supposed to do. So 2A at the top, it says the contractor in partnership with DMH shall conduct a feasibility study to evaluate the needs, and requirements for establishing unit, including, and then number 1, define the statewide market for adolescent inpatient mental health services with demand projections to determine the appropriate number of beds for the unit in Bennington. So, that term evaluate the needs for additional adolescent inpatient beds. When you look at it in the context of the language, it's simply referring to the existing feasibility study. It's not suggesting, the language says as specified in the bidder proposal. So this language all refers back to the existing feasibility study, not to add something new or different. And if the word evaluate, although that was the word in the contract, if it would be more helpful to say to define the need, because number 1 goes on to say define the statewide market, it's just reflecting that this is a component. In fact, it's the first listed one. It's a component of that feasibility study that's going to be reported back. And my concern is, as Stasio said, and as the department said yesterday, I think that there is a kind of, in terms of the public messaging, there's a bit of a misunderstanding every time it talks about increasing additional youth psychiatric beds. Because in terms of the number of total beds, at least as DMH has explained it to me, there's not an intent, nor has there been any kind of a data study or so forth, that the total number of current licensed beds be increased. It's about the fact that the retreat cannot staff and fill all of the ones it has. So they want to increase other locations for 2 reasons. First, the retreat can't handle medical needs. It's a freestanding model of care. It's not integrated, but also they can't meet the overall capacity needs of the state because they can't keep all their beds open. So, a lot of the language seems to suggest that there's a need for additional, beds, like as in additional licensed beds, which actually there may be some impressions, there may be anecdotal evidence, but there really has not been any kind of data analysis done, and I'm not suggesting that be done because they're not proposing increasing license capacity. They're proposing creating a separate unit at a separate location because the retreat can't meet those needs. And that's what they're asking Bennington to do right in the contract. So maybe the wording isn't clear. You know, I thought that because it referred to as specified in the existing contract, as described in the feasibility study, there's absolutely no intent to add any work or change an RFP. It's reflecting exactly what is there, but it's just making it sort of public that this is a part of it, rather than the impression that there isn't any need to evaluate that piece. So, and I also, just to clarify, I'm assuming that is the only area of concern, that the second proposal, which adds the specification that this is to accommodate co-occurring disease, as opposed to increasing the total capacity of licensed beds, that there isn't a problem with that part. Because you didn't reference that, and I'm assuming that is consistent from the DMH point of view, just to clarify where there's.
All right, so we're gonna let Nicole have the last word, and then we need to have a committee discussion because we need a straw vote. They're gonna hold the floor for a couple minutes, but we can't take much longer. Go ahead, Nicole.
So I would leave that to the committee to make a decision. I would say from the Department of Mental Health position, our preference would be to not include that language, just because we want to, you know, without the response from the feasibility study yet, we want to be careful about maybe restrictions that we put on things that may be a challenge with moving forward. But I do think there is certainly room to add some language there. So I would leave that to the committee's good judgment to make a decision how to move forward.
Nicole, is the feasibility study already in the works? Are they already working on it?
Oh, yeah. In fact, we should have some, be able to report out some preliminary stuff probably towards the end of this month. Although their actual written and final report is not due until March 31st, they should be able to give us some sense of what their conclusions will be around the end of this month.
Great.
And we're happy to come back and chat with you about what, you know, where we think it's headed prior to that final report.
Okay, thank you.
So can I just?
Yeah.
I mentioned before, and I think, you know, it may be helpful. Rather than to use the word evaluate, even though it's in the contract, but that might sound like it's something new or different, to use the word define, which is what A1 uses, define the market to determine. So if it said, you know, define the need instead, you know, that may make the committee more comfortable with making it clear that it's not to change anything about the feasibility study that's already underway.
Okay, Alyssa?
We want to open it up.
Yeah, let's open it up for discussion.
So first of all, thank you so much, both of you, coming in. Representative Donahue, you started in one of your first sentences that your intent is not to disrupt. You wanted to clarify. And I think what DMH is saying is that this does disrupt the process. And frankly, I'm not sure it clarifies. I think the language obfuscates it even further. I think the language is, I think it's good as is. And, you know, as DMH's position, do we really want to do a new contract? Do we want to slow things down? This is already in the process. They've already evaluated the need. We know that there is a need for this. We don't need to redo, do we have a need? We know we have a need. And it's in the process. And maybe the feasibility study will come back that it is not feasible at this location. But that's why we're putting it in the BAA, because we want to make sure that when things are ready, they can hit the ground running with it. And I just want to remind people, every single time you delay something, I know it doesn't seem like a lot, a week, a month, 2 months, but if you're a kid sitting in an emergency department, that's a really long time.
Maureen?
I want to thank you for coming to us with this. I believe that and I have trust in the group of stakeholders, the entire group that has worked on this whole process. And I agree that anything that would interfere with the good work and many, many conversations they've already had would be damaging.
Anyone else?
I'm going to say something.
Sure.
Being new, I understand what you're trying to accomplish. And when I make a decision, I always look at the unintended consequences. And I know it slows the process down, but to whose advantage? I'd rather do it right and make sure we've dotted all the I's and crossed all the T's than do something because it's an emergency need, because sometimes that'll come back and bite you. So.
Good. And then, good.
I appreciate Representative Donahue that anytime you come and you add your voice to healthcare and the evolution of our system, especially to that of folks living with mental illness and our youth especially. And I appreciate that. I know you've probably read all of the reports coming from Nicole's team back at DMH, including those that report on the evolution or lack of capacity in our system this year. Many of those have been delivered as recently as 2 weeks ago. And they're sobering. And that's why I think Representative Black really says it better than I could, that I believe, unfortunately, that there is a need for this facility. And I believe that we should support the potential of doing this. And, I look forward to seeing the feasibility study and whether that need is really there. And I also will thank you for continuing to come and bring your expertise and your voice to this room. Thank you.
And then we're going to need to.
Yeah, very briefly. I want to reiterate that this is not, it may have been misread. It may have been misunderstood. Maybe we really needed legislative counsel in terms of the technical language. It is only referencing what's existing in the contract. It is not adding any work. It's not adding anything to the contract. It's not adding any delay. This is already stated in the contract that this is information that's going to be part of the feasibility study. So it's not adding, it's not creating a delay, it's not adding any new requirements. It's simply referencing the feasibility study and the fact that that feasibility study is going to be evaluating the need, as it says in the contract, and the site. Maybe it should say the need for the site. But it's simply incorporating what is in the contract. It's not adding anything or changing the contract or changing the feasibility study. It's simply referencing it.
So I will just add my thoughts, and then we do need to take votes. We need to get right into the devotional. I also appreciate you coming forward. I appreciate that you continue to look out for the needs of Vermonters the way you do, and it's a expertise that you have done for a long, long time here, and we need it. With that said, I do believe the conversations and the negotiations that led to this contract between DMH and SVMC, we were not privy to, and therefore changing what we think, changing our language to reflect what we think the contract says versus what was determined to be what was said between the two negotiating parties would potentially put a delay on this project. And again, we are putting it in the BAA to send the message that we know there's a need and we want to be able to act appropriately when we can. I'm going to make sure Nicole comes back with some preliminary results of the feasibility by the end of February. The report's not due till March, but let's make sure we get that on the calendar to ensure that we are following this process really closely. And if we're seeing problems with the feasibility study where we think, whoa, this isn't really playing out to what we need, we will reevaluate and make changes in the budget process or at any point this session. So that's my perspective. So we're just going to do a straw vote. We do need everyone to vote with a raise of the hands, and I will count. So those who are in favor of Anne's language, please raise your hand. 2. Those who are not in favor of the language, raise your hand. 1, 2, 3, 4, 5, 6, 7, 8. And we are 1 short. So 2, 8, 1. Thank you, Anne. Thank you, Nicole. Everyone else, we got to get